It was a busy afternoon when a young man came to the emergency room. He had fallen off his motorcycle on the way home from work. His right leg was bleeding, and he looked pale and in pain. The nurse immediately brought him to the treatment room, where the doctor was ready to examine him.
Sore itu cukup sibuk ketika seorang pria muda datang ke ruang gawat darurat. Ia terjatuh dari motor saat pulang kerja. Kakinya berdarah dan wajahnya terlihat pucat serta kesakitan. Perawat segera membawanya ke ruang perawatan. Tempat dokter sudah siap memeriksa kondisinya.
Hello, good afternoon. I'm Dr. Kevin. What happened to you, sir?
Good afternoon, doctor. I fell off my motorbike about 30 minutes ago. My leg hit the road, and now it's bleeding quite a lot.
I see. Let me take a look. Can you tell me exactly where you feel the most pain?
Mostly around my right knee. It's really painful when I move it.
Alright, please try not to move your leg for now. The wound looks quite deep, about 4 centimeters long. It's a clean cut, but you'll need some stitches.
Oh no, stitches? Will it hurt, doctor?
Don't worry, I'll give you a local anesthetic first so you won't feel any pain during the procedure.
Okay, I'm a bit nervous, but please go ahead.
That's understandable. Accidents like this can be scary. Did you lose consciousness after the fall?
No, I didn't. I was wearing a helmet, but my hands and leg got scraped badly.
That's good. Wearing a helmet probably prevented a more serious injury. Have you had a tetanus shot in the past 5 years?
I'm not sure, doctor. Maybe not.
Alright, we'll give you a tetanus booster just to be safe. I'll also clean your wound properly before stitching it to prevent infection.
Thank you, doctor. It really hurts when you touch it.
Yes, I know. Please bear with me for a few seconds. I'm cleaning the area with antiseptic now. You might feel a bit of stinging.
Ouch, yes, it stings a little.
I know, but we're almost done cleaning. Now I'll inject the anesthetic. Take a deep breath, and exhale slowly.
Okay.
Good, it should start to numb in a few seconds. Can you still feel anything?
Not really. My leg feels numb now.
Perfect, I'll start stitching. It'll take around 10 minutes.
Doctor, will I be able to walk normally after this?
Yes, but you should avoid bending your knee too much for a few days. Keep the wound clean and dry. I'll prescribe antibiotics and painkillers for you.
Alright, how long until the stitches can be removed?
Usually about 7 to 10 days, depending on how well it heals. You should come back for a checkup in 3 days so we can see the progress.
Thank you very much, doctor. I really appreciate your help.
You're welcome. Please be careful when driving next time, okay?
I will, doctor. I've learned my lesson.
Good to hear that. Alright, I've finished the stitches. We'll cover the wound with a sterile dressing now. You're done for today. Get some rest and take your medicines as directed.
Thank you again, doctor.
You're welcome. Get well soon.